Starting today, people in France must use a so-called sanitary pass to visit cinemas, museums, or sports venues. This is Paris today, just outside the Louvre, and nobody is allowed inside unless their health pass states they're fully vaccinated or had a recent negative COVID test. The mandatory pass will be extended in August to patrons of restaurants, cafes, and shopping centers. Thousands of people turned out last Saturday to protest the country's vaccine certificate. They call it an infringement on their basic rights. Still, the number of people booking a vaccine has soared in the past week, but so are cases of COVID. The government says France is now in a fourth wave after reporting 18,000 new infections in the last 24 hours. So, here at home, Quebec plans to implement a vaccine passport in September, should other provinces consider that. Mona Nemer is Chief Science Advisor to Canada. She is in Ottawa. Doctor, thank you for joining us.
Thank you for having me.
You've published a report on the pros and cons of vaccine passports. What are the benefits of introducing such a system in your view?
Well, first of all, let's remember that we're fortunate to have extremely effective vaccines that protect against hospitalization, against death, against, to a certain extent, against infection, and minimize the spread of the virus. So this is a great tool if we want to minimize the epidemic that we're living, if we want to resume normal life. Now, there are different ways to ensure that people in public places are not a risk to others. One would be to give them rapid tests before they enter these different venues, and the other one is to ensure that they are vaccinated through the vaccine certificates. So there's really no drawback in a way, because we have to think about not only the patrons and the clients and the people going to these different venues and these different activities, but also the people who work there and who are entitled to a safe environment. So that's what the use of the vaccine certificates and the rapid test as well can give you.
We've just outlined what's happened in France, right? The people who want to go to cinemas, museums, or sporting matches, they've got to show proof of vaccination or that recent negative test. There's a resistance in certain parts of this here in Canada. I mean, would something like this even be feasible to implement on a national scale so that it's consistent across jurisdictions?
Well, it is feasible to implement if there is, a will to do it. And I think that the conversation has been, a little bit, perhaps, skewed towards the issues of privacy, the issues of being able to make your own decisions for your health. And these are absolutely valid reasons. In terms of the privacy, I think there are technical solutions, so they can be managed, protecting your privacy, protecting your personal informations. It's possible, it's doable. When it comes to your right to be or not vaccinated, I don't think that anybody's talking about forcing people to get vaccinated. But if you make the choice not to be vaccinated, then you really have to also make sure that you're not a risk to other people. So it's your choice not to get vaccinated, but it shouldn't be turned into my problem. So I think that we need a little bit of nuance into the discussion and the conversation around the vaccine certificates. Mm-hmm. And we are in a public health crisis, after all. We're not out of it yet. And we've been doing a lot of things collectively for the common good.
But you talk about bringing nuance into the conversation, but at a certain point there becomes this collision of rights, in terms of you can't force somebody to get vaccinated against their will, but then there is that broader public health consideration, and you don't have a right to go into a shopping mall or a Blue Jays game. That's not the sort of fundamental right that exists. So how do we reconcile these? And should the public health concerns trump, in some ways, those individual rights and freedoms that people are arguing for?
Well, depending where you are on the spectrum, of course, of all this, you will answer one way or the other to your question. So I think that the most important thing is that we need to maintain sort of a calm and reason in the discussion and in the conversation. I think in Canada we've managed really well compared to other countries not to politicize vaccination, testing, wearing masks, all the different public health measures. And it's been very beneficial for the country. Look, we're in much better situation today than many other countries around us. So I think that we just need to be respectful of each other and see whether the science justifies using the vaccine certificates as one layer to protect against resurgence, against outbreaks, and protect collective health. And yeah.
Oh, I was going to say one final thing I wanted to ask you about is the vaccination campaign in this country, because we are seeing pockets of the population that are just not getting vaccinated, and the daily vaccination numbers are dropping, and they're dropping fast. So what metric do you think we need to hit in terms of eligible population, for Canadians to really keep the spread of COVID at bay?
Well, first of all, I want to say how proud I am and grateful to the 80% of eligible Canadians who received their first dose, and encourage those who haven't received the second one to do as soon as possible. Encourage, of course, the others as well to get their vaccination. We heard a lot of different numbers, and collective immunity is a moving target. I think that the data now suggests that it's very difficult to achieve it with the more transmissible and more difficult variants that we have. So I think that we have to aim for really the maximum number of people. We have to listen to those who don't want to get vaccinated, understand their reasons. I think the vaccines are extremely safe. We have now hundreds of millions around the world who have been vaccinated for the past 6 to 9 months, and so I think that we need to strive to reach like 90% of the population, which is about 100% of the eligible population. So thinking that we're going to be able to keep the virus at bay simply through collective immunity is actually not going to be the solution. Pockets of unvaccinated people are a very good place to develop variants, and remind everyone that we don't only import variants, we also develop them in this country if we maintain spread among unvaccinated population. Right. So the answer really is to get as many people vaccinated as possible, and to maintain, as much as possible some of the public health measures, like masking indoors, and, vaccine certificates are a good way forward as well.
Okay, Professor Nemer, thank you so much for your time. We've got to leave it there. Thank you for joining us.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel, or click the link for another video.